I have become a veterans advocate because I'm working to help other people go through the veterans system, the VA specifically, in a way that is healthier than what happened with my son. So this is Daniel. At the time this photo was taken, he was a 90% officially declared mentally disabled veteran with a raging heroin addiction. I use this picture when I speak to people about legislative activities for veterans because nobody can imagine that somebody who looks like him was dealing with the kind of serious issues that he was dealing with. If you imagine a veteran with a mental health disability declaration and a heroin addiction, you're most likely thinking of somebody sitting on a cardboard box, drinking from a paper bag. So unless you know what is really going on in the hearts and minds of the people who have served, you are not best equipped to help them get the services that they have earned. And there are so many veterans who have been other than honorably discharged because of behavior related to their mental health illnesses because of their service, who are not eligible for benefits through the VA and need them desperately. Benefits that they were promised, benefits that they have earned, and benefits that we need to work to get them. So in Daniel's circumstance, he was still living in Fayetteville, North Carolina. In Fayetteville, there's Fort Bragg, which is enormous, approximately 100 to 150,000 active duty members at any given moment, and Pope Air Force Base is attached to Fayetteville. Anywhere from 35 to 75,000 airmen are at Pope Air Force Base. Any year, on average, about 10 to 15% of those military members leave their service from Pope Air Force Base or Fort Bragg. Most of them, approximately 80 to 85% of them, stay in the Fayetteville area because their children have started school and their spouses have jobs, and this is the only home they know. So at the VA in Fayetteville, North Carolina, they not only have veterans from other conflicts, from previous conflicts, they have discharging young service members with young families, all trying to get services from a VA that is not adequately equipped to handle the influx. Because there wasn't enough staff on board, Daniel had to wait for 13 months for his declaration and 16 months for his treatment. So for the last 13 to 16 months of his life, I spoke to Daniel every single day. He had a plan for what he was going to do to legislate for veteran-friendly treatment through the VA. And he gave me a blueprint. I started doing the work for him. I got a piece of legislation passed that was word for word exactly what Daniel wanted. And it was only because I met the right people at the right place at the right time and was able to get it done. But there's now a piece of legislation in the Veterans Organization that requires that discharging commanders inform the VA of a service member who is leaving with an already existing diagnosis so that they don't have to wait 13 months to get their diagnosis officially turned into a disability declaration. The day of discharge, the commander's office calls the local VA and has a member of the staff drive the veteran to services for evaluation that day.